Good afternoon, everyone. Thank you for joining today's briefing. In North Carolina, we now have 2,093 confirmed cases of COVID-19, covering nearly all our counties. Sadly, we're also reporting 19 deaths today and 259 people in the hospital. We continue to pray for the families of these souls, as well as the people currently sick and recovering from this terrible virus. Even as we acknowledge passing 2,000 cases here, we're entering the first weekend of my order to stay at home. I need you to do just that. I know it's tempting to get away from all this and gather with friends and extended family, especially when Friday means the end of the week. Don't. This virus is still spreading quickly. No one is immune. There is no vaccination, and social distancing is our best protection. Now is not the time for beach trips or neighborhood cookouts. If you must be with other people, please heed the order that bans gathering of more than 10 and recommends staying 6 feet or more away from each other. It could save your life and prevent the spread of the virus to people that you care about. Now, even though we don't yet have medicines to stop the virus, we do have something that can. People. Stopping the spread is in our control. If we avoid mass gatherings, if we wash our hands like never before, if we stay at home as much as we can, if we keep our physical distance, these things work. As we continue our state-level efforts against this coronavirus, we want you to know that we're fighting this battle on many fronts. The first front is the fight for medical supplies and personal protective equipment. This is a bad situation, folks. North Carolina has received 3 shipments from the Strategic National Stockpile. We're grateful for these supplies. But to be clear, we've gotten just 33% of what we've asked for, and they've told us not to expect more anytime soon. Now, of course, we know that we can't rely solely on the national stockpile, and our emergency management teams are working around the clock to find the equipment that is so badly needed by those on the front line of this pandemic. But we're not the only ones. Right now, governments at all levels, hospitals, law enforcement, and others are competing against each other for a scarce amount of personal protective equipment. That means our buyers are placing orders nonstop, but most of them aren't getting filled. There simply isn't enough on the market to go around. I know many of us have experienced this on a personal level. You go online to buy cleaning wipes or disinfectant spray, and it goes into your online cart, but when it comes time to pay, the screen says the order can't be filled and the item is out of stock. The state is dealing with the same problem, but on a massive scale. So if supplies are short, we have to make more. Here in North Carolina, we're encouraging manufacturers across the state to shift their production lines to create the masks, gloves, gowns, and other materials that we so desperately need. Some of those manufacturers are responding positively. And I know the President has ordered some companies to ramp up production of ventilators. This is important and badly needed. But the federal government can and should do more to direct industries to help produce these supplies. This pandemic is a war, and we need the armor to fight it. Another front we're fighting is helping people whose jobs and livelihoods have been lost in the blink of an eye due to this cruel virus. Through executive order, I've made unemployment insurance more widely available. But we know that has also put unprecedented strain on the system. More than 100 times as many claims as usual have been filed. I know that it's been a struggle to file claims and to get questions answered on the phone. I've heard it from people personally. Every claim represents a family on the edge. Every claim is crucial, and I will continue pushing until this is fixed and the process works more smoothly. Lockhart Taylor, Assistant Secretary of Commerce for the Division of Employment Security, briefed you yesterday on efforts to improve and increase capacity for unemployment benefits. I expect them to do this quickly, and he's here today if you have more questions for him. And of course, we're battling on our most important front to keep people healthy and safe. We remain concerned about our congregate living facilities where people are confined and living closely together. Secretary Cohen will discuss that issue in a minute. We're also closely monitoring our hospitals to make sure they have enough beds and people to care for seriously ill patients. And again, this is an area where everyday North Carolinians have the power to help. People ask me a lot, how can I help? What can I do? Well, if you're home watching this news conference, feeling nervous or powerless, there is something you can do. You can stay at home. You can keep your physical distance. You have the power to slow the spread. Thank you to the North Carolinians who are staying at home. You're protecting yourselves, your families, your neighbors, and our critical workers. You are saving lives. So now here we are. The weekend is coming up. Lots of Tar Heel blue skies are in our forecast. I know it's hard, but stay at home anyway. We are in a crucial time period for flattening the curve, and we still need you to step up.